You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in just a few appointments. We're talking about dental implants. My first guest is an expert on the topic, Dr. Christian Yaste. Dr. Yaste, welcome to the program.
Thank you. Great to be here.
Now, before we get into today's topic, tell me about your practice, because you do more than dental implants. You kind of have a team approach there.
We do.
So what do you do? So you do more. You do everything.
We do. There's 3 doctors in our practice, and we have one doctor that does just about everything from cleanings and fillings and crowns and bridges.
Okay.
We also do more advanced procedures. So my partner and I, Dr. Joe, who'll be on in just a few minutes.
Yeah, he's next.
He and I have kind of taken our practice to a level where we do a lot of, number one, cosmetics. So we do the dental veneers. You've heard of smile makeovers. We do that. We've got part of our practice where we focus on sedation. So we help people that are dental.
Is it IV sedation, oral sedation?
It's actually oral sedation.
Okay.
And it's wonderful. It's very popular because if I were to do IV sedation on you and you were afraid of needles, you wouldn't want a needle in your arm, right?
Right.
Any more than you want a needle in your mouth. Okay. So,
all right.
So we do a lot of the sedation, and we help a lot of dental phobics. And then we also have done a lot of dental implants, and that's what I'm really excited to be here to talk to you about dental implants and how that works in our practice and how it's completely changed dentistry in the last 10 or 15 years.
So what are the different categories of dental implant patients that you see?
Okay, so we get somebody that comes in and says, I knocked out my front tooth.
Okay.
And, you know, here it is. So what can we do to fix that? And we can place an implant. So a single tooth implant goes in and you basically have a tooth again. You can floss around it.
Why is it better than a bridge?
Because an implant...
Don't hold back here, doctor. I could tell.
It's better because it's like having that natural tooth back. And you don't have to do anything to the teeth on either side. So you've got these 2 teeth on either side of this empty space, and you would have to, you know, remove some structure there, reshape those teeth. Nothing wrong with that. Bridges have been around for years. We still do them. But if we can do an implant...
It's always better, like, to just get your tooth back.
Almost always. And you preserve the bone, so you don't lose bone in that area anymore.
All right.
So a front tooth, you know, if you lose that bone over time, you're going to have... It gets smaller and smaller and smaller. The bridge isn't going to look exactly the same in 10 or 15 years. The implant's going to keep it there. It's always going to look great.
Okay, next level up then, as far as categories.
So you've got somebody that comes in maybe has a couple missing teeth.
All right.
So say 2 or 3 missing teeth, or 4. So you can put implants and then also put traditional bridges, which you probably know what those are, and you can put those in and set them on the implants. And then you've got denture wears. So you've got people that need to lose all their teeth, and they have to go to dentures or implants. And then you've got people that wore dentures for 30, 40 years.
In your town or in your county, are there a lot of denture wearers?
Thousands. There's thousands of people that have lost their teeth, either or going to lose their teeth. So they've got teeth that got to go from gum disease or whatever. And then there are people that have worn dentures forever. And the hardest thing is they don't know what the options are for multiple reasons. So they don't know, well, you know, can I have dental implants, or do dental implants hurt, or are they not cost effective? Can I afford dental implants? All those sorts of things. I actually brought some models of some so that I can show you.
So the people that come in, like the denture wearers specifically,
yes.
You're saying that they just don't know their options. Why?
They don't know their options because they haven't been to the dentist for so long. Okay. A lot of them have had their teeth taken out, and that was the last time they saw the dentist. So maybe they'll go back for a reline or something like that occasionally. And a lot of the dentists aren't comfortable placing implants. So you've got other doctors that are specialists within the area of dentistry, and you've got people like my partner and I who are general dentists, but we actually do the surgical part of the dental implant.
Let me get this straight. So how it's normally done is you go to one person that's a surgeon that puts the implant in, and then another doctor that will put the tooth on top.
Yes, and to me that's a real benefit for someone that wants to come into our practice is we get to take it all the way through the process.
Okay.
So the end result is kind of where we start. We look at, okay, what do you want? What's the end result? Would you like? Would you like a full set of teeth? Are you just missing that one tooth? And then we kind of backtrack from there and we start the planning phase. So we can actually start with, you know, the end in mind.
End in mind. Okay. So your goal, if there's so many people, you say thousands of people that have an upper or lower denture, is to just get the word out. You brought those models.
I did. I brought.
Do you show those to patients?
So, I do.
You're talking to who? A denture wearer?
Yes, somebody that comes in and says, "Well, I'm scared. Either I'm scared to get all the rest of my teeth out, even though I don't." And I've got some pictures for you too.
Okay.
But I'm going to list lose the rest of my teeth. So what are my options? I'm afraid. I don't want to have my teeth taken out because this is better than nothing, right?
Okay.
I mean, you'd rather have some teeth than no teeth, right?
Yes, yes.
Okay, unless you're in a lot of pain. So someone that comes in, or somebody that is missing teeth already, and they need, you know, they want to hold their denture down a little bit better. So
okay,
okay,
so people need to know this is.
So that's
this
a model.
actual?
That's a replica of a lower denture. So try to take. So see how that was kind of snapped.
Is this an exaggeration of how hard it is?
No, I've got one that's even harder for you to take off if you want to try that one.
Okay, good. So you have two what? These are both dental implants.
Those are two dental implants. That's
little
where we get
snaps right here.
Correct.
And that just snaps in. Well, that seems like you couldn't even take it out. I mean, if you're 70 or 80.
Oh, you can take them out. We can adjust how hard they are to take in and out. So this is kind of where we start. We start with two dental implants. Now
what could they eat with that, by the way?
Okay, so I have a patient that can't eat salad. So she comes in and she says, I really want to just eat salad again. Two implants, and now she can eat a salad.
Okay.
She could eat steak. She could eat corn on the cob if she wanted to.
Interesting. So on the consult, they try that. Do they have a tough time pulling it off?
Oh, yeah.
Okay.
A lot of times they'll try to take this off and they'll be like, oh, it's attached. I think before the show we were talking about this, and this is two implants on the bottom, snap in, snap out. Then there's the top where this is really important.
So this is the top.
A lot of people have top dentures.
Okay.
And they can wear them okay in terms of the palate, the roof of the mouth.
Because there's a suction, right?
Exactly. So that suction kind of helps, but that suction also blocks off little taste buds.
So the roof of the mouth is covered.
So they can't taste their food. So in order to taste their food like they used to, and then also have their speech improved and all that sort of thing, we can place implants on the top and get it to snap in up there too. Now that generally requires more than just two implants. So
okay. So this is like 4 little snaps.
That has 4 snaps.
Okay.
Yes.
And so it just snaps right up.
No
more adhesive at all? By the way, a little bit of adhesive.
Very few of my patients have to wear adhesive once they get the implants in. In fact, I don't have a patient that's wearing adhesive that has implants right now. The next set of implants is fixed implants, fixed teeth.
Okay.
So now you don't have to take the teeth in and out. No more snapping in and out.
So that's probably what everybody wants, right? Teeth that don't come in and out.
That would be ideal. For most people, they would love to be able to have their teeth in all the time. So the advantage to doing that is you don't have to take them out. It requires a little bit more maintenance, so they have to come into the office more frequently. It's like having teeth again.
Like how often?
Oh, like every 3 to 4 months. Sometimes a little bit less frequently. Sometimes we graduate people to 6 months. But it's like having teeth again. So when you have implants...
So you come in for a cleaning, like every 4 months or so?
Right.
Okay.
Right, just like when you did when you had teeth. Now, some people would prefer not to do that. So if they want to come in less frequently, they can still snap in and out. But if they really want something that stays in all the time, then they get what we call fixed. And you can call it an all-on-4 and all-on-6. And that's where the teeth actually are fixed. They stay in all the time.
So final message to a denture wearer that's watching this, and maybe they think they're too old, they think it hurts, they have a lot of questions. What's your message to them?
My message would be give us a call. Number 1, come in and see us and have a consultation. It's free. And you can sit down with either myself or my partner, Dr. Joe, and we can talk about what your concerns are and try to build you a plan that, number 1, is it fits into your budget and your lifestyle. They could also come to one of our seminars because we have implant seminars every month. So that's a great way to come in and meet us and our team and find out more about dental implants and whether or not they're a good candidate.
And no more dentures.
No more dentures.
That's the future of
If it were up to me, we would throw dentures away.
And always have them attached to dental implants.
Always have them attached to dental implants or have the teeth go in and just keep them in all the time.
And they could eat whatever they want. I mean, and for the fixed set of teeth, because I never asked you, so if they get a fixed set of teeth, do they have to be careful?
No. If you have a fixed set of teeth.
So the denture comes in and you give them a full set of teeth that don't come in and out.
Correct.
They can eat what?
They can eat anything they want. Well, with the exception of taking beer bottles off with the front teeth and rocks.
But they could eat
They can eat a normal diet.
Could they chew gum?
They can eat everything you can eat, Randy.
Could they chew gum?
Yes. They can chew gum. They can eat
like broccoli.
They can eat popcorn. They can eat fresh vegetables. They can eat just about anything. Steak.
Good.
A tough steak.
All right. Do they ever tell you food stories when it's all done?
Oh yeah.
Like doctor, they do.
Yeah. I have a lot of patients that come in and say, when I go home, we're going to put these implants in. So I've got a patient named George. So George comes in and we put in 3 implants. And he couldn't eat anything before. He was on protein shakes. So we put 3 implants in on the bottom. He snaps them in. That night he says, I'm going to go out tonight. I'm going to have the biggest steak dinner I've ever had. He goes out the night. He calls the next day. He asks for one of our team members, and he says, tell the doctor I had the hugest steak last night ever. I can't hardly get out of bed this morning.
Is that right?
Yeah.
Good. Because you say it changes people's lives.
This procedure can take somebody who's absolutely miserable, who can't eat, who has no confidence, who's it can't kiss their spouse anymore, who has just a terrible self-esteem or just all kinds of pain. And this, just doing a few implants can take that person from right here to a complete change, personality change, feeling great about themselves. I have another story if you want to.
Good. Let's hear one more. We have about a minute.
Okay, so I have a patient. His name is Brian, and Brian worked at a car lot, and he washed the cars.
Okay.
Okay, because he couldn't interact with people. He would, whenever he would talk to people, he would kind of be like this, and he would cover his mouth, and people thought he was either dishonest, or he wasn't happy, or he, just wasn't a nice person. Brian was a great guy, but Brian had terrible teeth. So he came to us and he says, I have to do something. My fiance doesn't want to kiss me anymore. I have terrible breath. I don't know what to do. People don't want to be around me. After a very short period of time, and once we completed his treatment, he went from washing cars for the Chevy dealer to managing the finance department at the Chevy dealership.
Okay.
So he came back and he said, you know what? I was a little worried about the money I was spending in your practice. He says, I'm going to make that over so many times just by this advancement I've had in my job.
So you gave him dental implants?
Yes.
With teeth on top?
Such a, a huge success story.
And they look real? I mean, a smile, like a cosmetic?
He is a completely changed person. It's unbelievable what a difference it made in his life.
Now, we're out of time, but I know you want to show that photo. Before we got on, you said, I want to show you this.
I want to show you one of my favorite patients.
Okay.
This is a lady that came to me. She's in her 50s. She's a truck driver. She's a wonderful lady, but she had some teeth in the front, didn't have any teeth in the back, but the teeth had to go.
Had to come out.
A lot of gum disease, and we just had to get rid of them. So she was worried. She's like, well, if I can't chew now, how am I going to chew if I don't have any teeth? Can you help me?
She didn't want dentures.
She did not want dentures. But she was excited about being able to put something in and out, snap it in and out, and so we talked about implants. So this is her after we completed her procedure, and you can see in the before picture,
nice. Yeah.
She's really forced that smile. But now it just totally comes natural. She's super happy. I mean,
say you always get pictures with your patients.
Every time she comes in, she gives me a hug.
Good. Would you say that when you could take a denture wearer and give them a fixed set of teeth, that this is the happiest group of patients? Because I know you do a lot of cosmetic dentistry.
Correct. This is where it gets life-changing, because it's not just about my teeth looking good. It's about being able to eat.
Okay.
Which we mentioned earlier. That's one of the last things people enjoy in their lives, is being able to eat. I mean, you love to go out to eat, right?
Yeah, yeah.
So if you can taste your food and you can enjoy chewing it, and you don't have to have people staring at it, or you're not worried about them coming out when you're eating, it just makes it so much easier.
All right, good. I want to thank you for coming on the show.
Thank you, Andy. Appreciate it.
You've been watching The Wellness Hour. Up next, more about dental implants and the process. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my second guest here. He says you can get a fixed set of teeth in just a few appointments. We're talking about dental implants today with Dr. Hufanda. Dr. Hufanda, welcome to the program.
Thank you. Thanks for having me, Randy.
Now, we had your partner on the show.
Sure.
And, what I think everybody, which is great, they probably like that you guys have known each other since high school.
Yes.
Is that right?
Even before high school, we knew each other. And
now he told me on the show, before we get into your practice, but you wanted to be a dentist. It seems like since you were a little kid.
Yes.
In fact, there's a video of you he said he took. This is Dr. Yaste said he has a video of you your senior year in high school, like a senior video.
Sure.
Saying, what do you want to be when you grow up? And what'd you say?
Yes, I remember that day vividly, because he was coming around videotaping as to what our thoughts were we were going to be after school. And I had told him I want to be a cosmetic dentist. Now, even to this day, there's no such thing as a cosmetic dentist. But I wanted to have a center where we focused on whole body wellness, being paired up with a plastic surgeon, and it really came real close.
Now, you wanted to be a dentist even before that, I think you told me.
Yes. Both my parents are in the medical field, and I didn't want to to be the traditional doctor that goes into the hospital, even though it's exciting. I had a creative streak. I do have a creative streak, and I liked working with my hands, and dentistry is art form. I mean, when you really think about it.
Okay, good.
You can change someone's life, and it's beautiful at the same time.
Good, good. So dental implants, and we're specifically today focusing on, you've been invited on the show, talk about what you can do for people with false teeth or dentures.
Sure.
And we say no more dentures. Elaborate on that. You believe that? That's the future?
Oh, absolutely. In fact, we got into implants and implant restorations early on in our career. We were always looking for something that we could do to improve our patients' lives. And it just became perfectly clear that if you have people with dentures flopping around, having to eat soft foods because they couldn't chew or having pain when they were eating, this was something we could offer to our patients that would really improve the quality of their life.
Okay, good. So how long have you been doing it?
Probably more than 15, 20 years.
More than 15 years?
Yeah.
And how has it changed? You know, why is it easier today, as your partner says, than ever before?
Well,
I mean, more people are candidates today than ever before.
That's a great question.
Hardly hurts today, he said.
Sure, because it is, the philosophy has changed. Years ago, we used to think that you had to place this titanium thing in your bone and let it stew or heal for about 9 months, 12 months before you got a tooth in there. The materials have changed, such the coatings that are now on these implants help with rapid integration. So you can actually put something on these implants, be it a tooth, a supported denture, to really be able to have that function in a lot shorter time.
Okay. Are there a lot of people in your town, in your county, that have dentures, like upper or lower dentures?
I would imagine there are thousands of people.
What's your guess? How many?
I couldn't tell you, but there are thousands.
Like thousands of people?
Oh, sure. Because it's one of these things. We don't know because they don't ever come to the dentist. You know why? Because they don't know their options.
They don't know their options. So why, I mean, if it is so good, that's a good point, that if dental implants are so good for denture wearers, where they could just get, you say, 2 implants, get a snap in, snap out denture, why aren't they all doing it?
One, that, you know, they don't know their options. 2, they haven't been to the dentist in a while. Other times, maybe it's just for relines. But understand this, they've been through a lot with their teeth before they had their dentures. It reminds them of the pain they had, the discomfort, so why would they want to go back? Okay. This is what draws them in, the pain and discomfort of their false teeth.
So the last thing they want to do is go to
the
dentist.
Right. Also, some people think they're too old. And I can tell you this, we've done implants on someone who's 20-something versus someone who's in their 80s.
Why would an 80-year-old want to get dental?
She wants to be confident with her smile as well, just as much as a 30-year-old. Here's what she told me after I sat her up, and she's one who didn't pick sedation to do this.
Okay.
Sat her up, she had 2 implants where she had spaces. She goes, was that it? Was that it? I said, you know, honey, you are tough. You're tough. I have 20-something, 30-year-olds that just have a little bit more discomfort, but I'm telling you what, she was just a trooper, and she did great. And she said, if I had known it was this easy years ago, I would have done this sooner. Okay.
Is your goal to wipe out traditional dentures in North Carolina?
Well,
one of your goals?
Yes, it is, because you know, a lot of people are needlessly having to suffer teeth that are not comfortable, not being able to be comfortable in social relationships. Yeah.
Now, I know a few denture wearers, and I never hear them complain about their dentures.
Well, they wouldn't complain to you. You can't do anything about it.
Okay.
Oh, well, but no, I take that back. You're helping spread the word about it.
All right.
So, and this is what denture wearers tell us.
Like on the consult.
On a consult. Well, actually, you know what? Here's the thing. This is what we take for granted, those who have nice teeth, okay? You get up in the morning, you brush those pearly whites, take your shower, run your hands through that thick black hair, and you go out and do what you do all day.
Okay.
Denture wearers, from what I've heard and what they've told me, are sometimes held hostage by their teeth. They wake up, they've got to put those things back in their mouth. They have to glue them in. They have to think where they're going because they may not be able to eat where their friends are going to. They may even be dealing with issues of, you know, people perceive them as being grumpy because they're not talkative. They're scared their denture is going to fall out of their mouth. So without having that ability to function what we take for granted. It's very hard for some denture wearers. Another reason why denture wearers don't come in is because they're scared of pain. Now, who wouldn't be, right?
Yeah.
But they want to know, is this process going to be painful? And I can tell you, our patients really don't suffer through any pain.
It seems painful.
You know, you might think that would be the case, but it's not. The jawbone actually does not have a lot of nerve endings, and it's just like hair, nails, you know, when you cut those, you don't feel that.
So it doesn't hurt like that. Okay, so what are, I know you brought photos.
I sure
and
did.
we're short on time, and you brought these models. Okay, so a denture wearer goes into your office. Take me through that process. Like, what do you guys talk about?
I asked them, what do they want? If they say, I want my teeth to stay in my mouth, I don't want them clanking around, I want them solidly in there so I can chew and eat the foods I love, and the foods that are healthier for me. The first options we look is we take a 3D cone beam and see, one, where the bone is. Because it used to be, we used to have to go in and find the bone. A lot of the technology now is so precise that we can now see where the bone is, make smaller incisions, and that's why it doesn't hurt.
Okay.
Okay. But there are options of, you know, 2 implants, okay?
Let's take a look at this.
Snap in.
Okay, so 2 implants, where do they go?
Right around here.
There. So this is a set of teeth right here, and you just put it right here. And your partner also showed me this model. But so you show this on the console.
Oh yeah, and they're excited just seeing that because, man, imagine if I can keep that in there.
Is this a little tighter than it really is?
No,
this is tight.
No, I'll share a story with you.
Okay.
Now this is just with 2 implants. I have a patient we placed. We had 4 implants in place because she wanted to make sure they were not coming out. She confessed to me that she has to use a butter knife to get those dentures out because they're so retentive. Now, people listening to this, they would love to have that problem. They want,
is that right?
They want to have these things stay in there real tightly.
So can they eat? I mean, they really can't eat what? Did they ever tell you eating stories? Like, what can they eat? What have you heard?
Well, okay, I have to share this story. We had a patient come in, and she goes, listen, my family reunion's coming up. And 1, I don't want to have teeth looking like this. 2, I want to eat what I want to eat. I said, well, honey, tell me what you want to eat. Well, I want to eat barbecue. You know, I want to eat corn on the cob. I want to eat the good stuff. I said, you know what? We can help you do that. We had to figure out what she needed. And in her case, we had to remove the rest of the lower teeth. She had a partial that wasn't sitting well, and the teeth were loose. So we placed 2 implants, and within a couple weeks, she was able to snap her lower denture in. And when I saw her for the follow-up, I said, so gearing up for this barbecue, this family reunion, what you gonna do? She goes, I'm just out of my mind. I just can't tell you how much fun I'm gonna have at this family reunion. It's hard to say what we've given her back because she has now the ability to chew, to function, to be lively, because before she would hold her hand over her mouth, she was ashamed of her smile.
Good.
But now this is just something that, you know, the possibilities are endless for her.
Now, a fixed set of teeth. We said that they could get a fixed set of teeth. How many dental implants for that?
Now, for that, you're probably looking at somewhere 4 to 6, sometimes 6 to 8, depending on what you want. There are so many options out there. That's why I would recommend, we have implant seminars on a monthly basis, that if people are interested, come in and find out your options.
Go to the seminar.
Yes, go to the seminar.
You?
Meet me, meet my business partner, meet our associate.
Dr. Yaste.
Yep, Dr. Yaste, and then our associate, Dr. Mercado. She can explain as well and kind of get some options together and give you some idea of what you could be looking at.
Okay, good. Now you brought a photo and we're almost out of time.
I sure did. Now this is
a dental implant patient?
It sure is. This is his before smile.
Okay. All right.
Not really smiling, huh?
Yeah.
Well, he's in sales, and his big thing is he was told he needed to lose his upper teeth from periodontal issues.
Okay.
So he was making that decision. What am I going to do? Have to be in front of all my salespeople and have to talk and my denture fall out? That wasn't happening. He said, I want something that gets snapped in.
Okay.
So we went through the plan of really saving his lower teeth, doing a couple caps, but on the top we placed 4 implants. And I'm telling you what, this guy speaks for a living. He can't be happier at this point that he made that decision. Now here's his after smile. You tell me.
So he didn't want a denture, a traditional denture.
What do you think?
Nice.
Yeah. Now I want to show you his before picture. He had a gap between his front teeth.
Okay.
And here's the thing.
Had a gap.
Okay. Now he didn't want anyone to know he had something done. So we actually copied that gap back into his smile.
So when you made the
cool.
snap-in denture.
Oh yeah.
Let's take a look.
Cool, huh?
Interesting.
So there's so many things when it comes to...
So you copied his former smile.
Exactly. Or if he wanted, we could have done anything else. We could have crisscrossed certain teeth, made them look as natural, or made them as, well, you know, Hollywood white, Hollywood straight.
You have nice teeth.
Well, thank you.
Are those dentures?
No.
Snap in?
No.
No, those are...
These
are those your
mine.
regular teeth?
These are mine,
No.
and yeah, these are mine, and I must say that...
You've just been lucky?
Lucky.
Because you have great teeth.
I never had any braces, so... but I can empathize with those who want a pretty smile, because they'll always say, I want teeth like yours. Well, I said, if I can take them out and give them to you, I would, but I can help you find a way to get a smile.
Well, thank you for coming to the show.
Well, thank
Very
you. It
good.
was my pleasure, Randy.
And
My pleasure.
so if somebody, denture wear, maybe they're watching this, they think it's too much, it's going to hurt,
Oh,
they
no.
don't believe it, it's too good to be true, what do you say to them?
Come on in and let us help you find out what your options are, explain the procedures, and help you get what you want.
Okay, good. Thanks again.
My
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.